Hi, I'm Liz Kerby, the certified health coach and live blood microscopist here at Renaissance Health Center. In my work here as a certified health coach, I find that most people have a pretty good idea of what to do to improve their health. My job is to give you the help and encouragement you need to actually do it in a way that works for your life. I also specialize in blood type testing and blood type eating, and I assist our cancer patients with their prescribed protocols. Today, I'm going to talk to you about live blood assessment, which is one of the cool things I get to do here. This is the microscope and video monitor I use for live blood assessments. And this is what it looks like when you come into my office for a live blood assessment. In a single drop of your blood, there is a whole world of information about your health. What are the normal things that should be in your blood? There are 4: your red blood cells, white blood cells, platelets, and plasma. The first normal element is your red blood cells. They carry oxygen from your lungs to your cells and carbon dioxide from the cells back to the lungs to be expelled. To do their job correctly, they need to be perfectly round, the correct size, and separated from each other in the plasma, as you see in this picture. The second normal element is your white blood cells. There are 5 different types: neutrophils, lymphocytes, monocytes, eosinophils, and basophils, each with their own job to do. The most commonly seen are the neutrophils and lymphocytes. In this picture, the large bright cell on the left is an eosinophil, and an unhealthy lymphocyte is in the upper right. Neutrophils, which are the bright blue shapes you see here, are about 65% of your white blood cells. They're like the Pac-Man of your immune system. They will actually change shape as they move through your plasma, gobbling up anything that doesn't belong there. They have 3 to 5 nuclei, which are the black shapes inside them, and the blue granules inside them will be actively moving around when the cells are healthy. This is a healthy lymphocyte. They are your infection fighters. They make up 25 to 30% of your white blood cells. You may have heard of B and T cells, which are both lymphocytes, although there is no way to distinguish between them in live blood assessment. The third element in normal blood is platelets, also called thrombocytes. They are one of your blood clotting factors. They look like little black dots in the plasma, as you see here circled in red. In live blood assessment, there is no way to do an actual platelet count. However, if I suspect you have too many or too few platelets, regular lab blood work can verify that. And finally, the fourth normal element is plasma, which is the liquid component of the blood, and it occupies the space not taken up by the other 3 elements. It is important to note that while live blood assessment cannot be used to diagnose specific conditions, it does give us very important information about the state of our health. Anything else in your live blood besides red and white cells and platelets, as well as any differences from what is normal for those elements, is called an anomaly. I'll show you some of the more common, less serious anomalies. Spreading platelets is by far the most common anomaly I see in live blood. It shows up as a grayish area around a platelet. It indicates too much protein in the blood, either from eating too much animal protein or not digesting the protein you eat. For most people, it is a combination of those 2 factors. Regular poikilocytes are red blood cells that have a corrugated edge, like a bottle cap. They indicate free radical damage, toxicity, essential fatty acid and antioxidant deficiency, dehydration, and poor diet. Ghost cells are the faint white and grayish cells that you see in this picture. They are most often associated with anemia and can also indicate deficiencies of vitamin B12, folic acid, iron, and trace minerals, and essential fatty acids. Sometimes, if they are really severe, you can see the red blood cells popping out to become ghost cells. Cloud patterns look like cloud drawings, and they are usually in ridges, as you see on the right side circled in red. They indicate inflammation, an acidic pH, trace mineral deficiency, and any itis condition, arthritis, sinusitis, colitis, etc., all those things that are associated with inflammation. Protein linkage shows up as lemon or teardrop-shaped red blood cells that indicate too much protein in the blood, inflammation, stress, coffee, soda, excess meat, and refined sugar. It can also indicate hormonal imbalances in both men and women. The circled cells on the left side of this picture are known as incomplete protein linkage because the cells are separate, and on the right is what's called complete protein linkage, where the cells are connected, sometimes in long strings. Rouleau is red blood cells that are stacked like a roll of coins. It indicates digestive imbalance and intestinal stress due to poor diet or enzyme deficiencies. When it gets to the stage that you see in this picture, it can indicate severe digestive imbalance or chronic degenerative disease. Platelet aggregation is platelets that are stuck together in clumps. It indicates an increased risk of heart disease, blood sugar imbalance, high cholesterol and/or high triglycerides, excess animal fats, and an acidic terrain. Stress, alcohol, tobacco, and caffeine all contribute to platelet aggregations. They are graded according to their size in relationship to a normal red blood cell. The circled one on the bottom left is a C-grade aggregation, or about the size of 3 red blood cells, while the circled one at the top is an F-grade aggregation, or about the size of 6 red blood cells. The pH of the blood stays in too narrow a range to actually see Candida in live blood, but there are 3 types of the signs of Candida called fermentation: red blood cell, plasma, and thrombocyte, or if you remember, platelet. These fermentation signs are roundish white forms that will appear within the first 10 minutes of looking at your live blood. When the fermentation signs are on the red blood cells, it indicates Candida overgrowth in the intestinal tract, blood sugar imbalance, intestinal imbalance, or excessive intake of foods high in sugar and starch, all those high glycemic foods I like to talk to you about in my work as a health coach. When the fermentation signs are in the plasma, it indicates Candida overgrowth in the intestinal tract and intestinal imbalance, which have now become more chronic, and also it indicates possible leaky gut syndrome. And when the fermentation signs are found around various size platelet aggregations, it indicates, like the plasma fermentation, chronic overgrowth of Candida in the intestinal tract and intestinal imbalance. However, with thrombocyte fermentation, leaky gut syndrome is now likely rather than just possible. Now I'd like to show you some of the less common anomalies in live blood. These generally indicate more serious problems and are significant when we see them. These advanced forms of poikilocytes indicate advanced toxicity low immunity, infections, stress, and possible rheumatoid arthritis. They look like balls that are studded, so I like to call them landmine shapes. RBC, or red blood cell aggregation, is more severe than protein linkage and rouleau. It is a sign of severe and chronic toxicity brought on by a trace mineral deficiency. It also indicates poor diet, dehydration, chronic stress, coffee, meat, prescription or recreational drugs, or cigarettes. Cholesterol crystals indicate plaque in your arteries or hardening of the arteries, poor fat metabolism due to lipase deficiency. Lipase is a fat digesting enzyme, and possible high cholesterol or high saturated fat intake. We can often see red blood cells underneath them, as you can see in these two pictures, and they sometimes have uric acid crystals on the surface, which are the small blue elements in the bottom picture. Here are a couple more pictures of cholesterol crystals, where you can see that sometimes they have straight lines and sharp angles. The bottom picture also shows some greenish uric acid crystals on the surface of it, over on the bottom left side of the crystal. A protoplast looks like a rock in the blood. It is made up of accumulated protein, fat, and waste materials. It indicates high toxicity and acidity, poor diet and lifestyle, and can also be associated with chronic degenerative disease. The larger the protoplast and the more jagged the edges, the more serious it is. Green globules around them, or green edges, as in the bottom picture, indicate a high fat content, and many have small uric acid crystals on the surface, which you see as the bright blue elements in both of these pictures. Rouleau, or red blood cell aggregation, platelet aggregation, and diffuse fibrin is an anomaly known as thrombosis. I have already shown you Rouleau, red blood cell aggregation, and platelet aggregation. Diffuse fibrin shows up as the sticks or threads that you see in the plasma in this picture. Diffuse fibrin, like platelets, is one of your blood clotting factors, although it doesn't usually show up in the live blood until after about 40 minutes. When seen together, these three anomalies indicate an increased risk of blood clots, conditions associated with heart attacks and strokes, and deep vein thrombosis. This is a high priority to address when we observe it in live blood. One client, who is also a friend of mine, showed signs of thrombosis in his live blood and decided not to do anything about it. 3 months later, he had a blood clot in his lungs. He was treated conventionally and is now taking blood thinners for the foreseeable future. His experience showed me that seeing these signs in live blood needs to be taken seriously. Another client could barely walk 5 steps without having to stop and catch his breath when he first came in. His conventional doctor had told him he had lung fibrosis. The primary anomalies in his live blood were these 3: thrombosis signs, plus thrombocyte fermentation, which you remember indicates chronic candida with leaky gut syndrome. I had him start taking the supplement we use for thrombosis signs, another supplement we use for candida, and I put him on an anti-candida diet. When he came back 6 weeks later, I could hardly believe it was the same man. He had stuck faithfully to the diet and taking the supplements, and he had lost 37 pounds and had no more breathing problems at all. So I want you to know that even when a live blood assessment shows anomalies that can be serious, here at Renaissance Health Center, we have solutions for you. Believe it or not, what I have shared with you today is only the tip of the iceberg when it comes to live blood assessment and what it can tell you about your health. It is an endlessly fascinating subject to me, and I hope you'll find it as exciting as I do. Call our office at 702-258-7860 to make an appointment with me, Liz Kerby, for your own live blood assessment. Thank you for watching. Bye.